I remember one afternoon sitting in my office with Dr. Hatfield. We were talking about ways we thought we could make research cool in our organization. How could we inspire clinical nurses to change practice through research? Then Dr. Hatfield had an amazing idea. Why don't we develop a research scholarship? A great idea. Then I remembered my first meeting with Dr. Aiken when I came to the health system. She spoke about how much she valued clinical nurses. Then I thought, what a great partnership. Dr. Aiken, who we know values clinical nurses and is an expert, world-renowned nurse scientist, and Dr. Hatfield, our very own nurse scientist, why not bring the teams together to lift up and support our clinical nurses through providing them time, CEUs, and the support of the experts to change practice through this program. I'm really proud of our nurse scholars and can confidently say that we have changed practice in areas such as shared governance. And in this video, you will hear about the studies they have done that have identified the value of shared governance on engagement and patient outcomes. We're really proud of their work. We're proud of each one of them and really grateful to Dr. Hatfield and Dr. Aiken for leading the way to making research cool at Pennsylvania Hospital.
Focused on our project looking at the environments of ICNs or intensive care nurseries and how the work environment impacted their outcomes. If nurses reported that the environments were more favorable to work in, that the outcomes of quality, safety, infections, in addition to moms and dads' abilities to care for infants after going home, definitely had an increase in their outcomes. Lindsay Verica and myself had the opportunity to present at the Academy of Health Conference in San Diego in 2014. This research was also published in a national journal, and there was a video that was created to go along with it that also was posted on that journal's homepage. Lindsay Verica and myself were able to present to senior leadership and were able to support the addition of over 40 nursing FTEs to help support patient care as well as nurse engagement, in addition to nursing satisfaction. We were also able to write a journal article that was published in the Journal of Nursing Administration that went over the cohort in the program in addition to the collaboration between the nursing staff and CHOPR. The Research Scholarship Program has helped me immensely in my leadership role here at Pennsylvania Hospital. I'm currently the interim nurse manager of the emergency department, and having this experience in the Research Scholarship Program has enabled me to take the voice of the customer, utilizing Press Ganey data and information, and also utilizing my governing organization, the Emergency Nurses Association, to look at evidence-based practice and guidelines and kind of ask those why questions and what if questions and turn evidence-based practice into meaningful change within the department.
We work with Dr. Linda Hatfield, Dr. Linda Aiken, and her team at the Center for Health Outcomes and Policy Research, or CHOPR, on a study that looked at the relationship between nurse engagement and patient and nurse outcomes. It was observed that hospitals that provide nurses with the greatest opportunities to be engaged, shared governance activities, are more likely to have better patient outcomes, better patient experiences and quality of care, as well as nurse job outcomes, decreased turnover, burnout, and job dissatisfaction. This research project was presented as a poster at Academy Health in Boston in June 2016. In addition, it was presented as a poster at the Penn Medicine Nursing Research Conference in November 2015. Based on the work that Sharon and I did with this project, we were asked to do a podium presentation on the data collection process during a research project, also at the Penn Medicine Nursing Research Conference. The opportunity to be a nursing research scholar led directly to a research project that I've been a part of on 5 Cathcart. My coworker and I, Ann Coughlin, collaborated on a study to examine the relationship between coloring mandalas on staff anxiety levels. The results showed a significant decrease in short-term and long-term anxiety, which was a subjective measure, as well as a decrease in heart rate variability, an objective measure of anxiety reduction.
Through this program, I gained a broader perspective of the importance of collaboration with experts in the field and of obtaining scientific evidence to change practice and sometimes change policy. Right now, it prompted me to join my professional organization, the American Psychiatric Nurses Association, and then I was offered and took a position as the Pennsylvania chairperson on the General Practice Committee.
I really think that the Nursing Research Scholar Program is a wonderful opportunity that empowers nurses to take their own ideas and actually do their own research. There's a lot of support in this program. You learn about various types of nursing research, so you get an idea of what you might want to use when you go back to your own units and start looking at things that you might be interested in investigating further.
In the third cohort, we looked at the association of nurse engagement and nurse staffing with patient safety. We found that nurses who were more engaged in policy decision and governance reported higher patient safety ratings. Our cohort was unique since we were the first to partner and collaborate with the scholars from Penn Presbyterian. Together, we disseminated our findings through publication in the Journal of Nursing Care Quality, and we presented our poster at 3 nursing research conferences throughout the United States. The poster was so well received at the 2017 6th Annual Penn Medicine Nursing Research Conference that we were awarded the Outstanding Poster Presentation. We also collaborated with the researchers at CHOPR and investigated the association of the hospital practice environment with nurse specialty certification. Our poster was presented at Academy Health, and we continue to work towards publication. With the knowledge and experience we gained through the program and the support of leadership, we have developed and conducted our own independent research study on 4 Cathcart and 7 Cathcart. Our study is focused on nurse engagement in early patient mobility. We are currently analyzing our data, and we aim to present our findings in the near future.
One great benefit of being in a program like this is the networking opportunities it provides. I feel like I've gotten to meet so many people that have helped me advance in so many ways. Beyond even the research work, which I love, I've been able to be involved in more QI projects, more shared governance opportunities, doing things on my floor, doing things throughout the hospital. And I think that the reason I've been doing so many of those things is because this program galvanized me to get more involved.
I've gained much knowledge and confidence to continue to engage in research, to question why, and to ask how we can make our nursing practice better and safer for our patients, their families, our colleagues, here and beyond the walls of Pennsylvania Hospital.
What the scholars have accomplished in this short period of time is simply extraordinary. The model, in a very innovative yet practical way, bridges the academic practice gap and benefits clinicians, administrators, faculty, and ultimately the patient and the family. The inaugural scholars published 2 papers. Working with Dr. Eileen Lake, the first paper demonstrated an association between better work environments and higher quality care and patient safety. It has been cited 19 times and was a critical study providing strong evidence for a $1.5 million Agency for Healthcare Research and Quality R01 award entitled NICU Performance, Missed Nursing Care and Infant Outcomes. Moreover, it has been utilized as evidence in 9 research studies. 3 of them were international studies and 4 literature reviews. They also published an article describing the Professional Research Scholarship Program. It was actually published twice, which is notable because journals have very limited space and do not often reprint articles. As an exemplar of an academic practice collaboration, the article has been cited 7 times. The program has been recognized as a mature research model in magnet academic medical centers and is considered an evidence-based program in a culture of leadership and mentoring. The second cohort worked with Dr. Ann Cutney-Lee to show that nurses' job outcomes and quality of care are significantly associated with nurse engagement to shared governance. The paper was cited as evidence for a pathway standard in the American Nurses Association Cerner Magnet Recognition and Pathway Award. 8 researchers used their paper as evidence for their work. 2 of the researchers were international, attesting to their global impact. Our current scholars working with Dr. Margot Brooks-Cathon have published a paper, ahead of print, demonstrating the association of nurse engagement and nurse staffing on patient safety. This is an area of critical to nursing and will certainly yield important new insights and impact. Another impact of this program is that Penn Presbyterian Medical Center was inspired to partner with Dr. Linda Aiken to adopt this model.
This was a great impact for our patients at Presby, but also what was even better was we were in time for our magnet redesignation, and having the scholars in this program really lifted our program at Presby and helped them meet the first magnet redesignation needs.
The academic practice collaboration with the Center of Health Outcomes and Policy Research exemplifies an academic practice partnership.
It's often said that it can take up to 17 years for research results that are published in journals to make their way into clinical practice. With our academic clinical partnership, we work together to dramatically accelerate this process. By leveraging the analytic resources of CHOPR and the clinical expertise of our scholars, we hasten the generation and the dissemination of new knowledge, which can then be rapidly translated back into clinical practice. What's truly wonderful about the Research Scholars Program is that it provides frontline nurses with the ability to learn the research process, but it also allows us as researchers to examine clinical questions that have true relevance and bearing on the work of nurses working in direct patient care.
This program has contributed to the professional development and leadership of our scholars. All 6 scholars were integral members of the Research and Evidence-Based Practice Core Council. 4 members have or had leadership roles in the Core Council, and almost all scholars have advanced up the clinical ladder. In addition, 4 of the scholars have been recipients of the Clinical Excellence Awards.
Research Scholarship Program means a lot to me.
It was an opportunity to experience all aspects of a research study from start to finish.
This program just is so unique, and that it ties in with Penn Medicine and what they stand for.
I still can't believe an opportunity as good as this even exists.
And that says everything about how great an environment we have here at Penn Center.